Pelvic floor therapy treatment 4 is the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. One of the questions that people have is, well, I have incontinence, so is that for me? Who else is pelvic floor therapy for? So the answer to that, I want you to think about pelvic floor dysfunction as the name of the book, and then it has many chapters. Each one of those chapters, whoever falls in those categories are candidates for pelvic floor therapy. So a lot of times we think about incontinence, pelvic pain, tailbone pain, perhaps testicular pain, erectile dysfunction, painful intercourse, and we immediately associate those to pelvic floor and pelvic floor therapy, which, by the way, don't need to be done by a pelvic floor physical therapists only. There are other clinicians who take the training to do pelvic floor dysfunction treatment as well. So that's a different subject. We've done a video on that, so we'll make sure we put it in the back of at the end of this video, and I've done a blog on that too. But the parts of pelvic floor dysfunction that we don't, as a society, generally associate pelvic floor therapy to are the ones with chronic lower back pain, the ones with hip dysfunction. We're not talking about abnormalities like one leg is shorter than the other. We're talking about hip mobility issues. We're talking about hip, not necessarily decreased range of motion, though that would fall in that category. Sometimes you have dysfunction, but your range of motion is still within the normal. We're talking about people with sacroiliac, the joint back here, conditions like those, poor posture where you're slouching forward. Those are all great candidates, and they all need to be receiving pelvic floor therapy treatments. The issue here is a lot of times we look at those conditions as if they're separate problems, and we go to different clinicians and practitioners for the treatment of those. But this is a dysfunction that has many faces and many portions to its existence, and they need to be addressed. So that is my advice to you. Catch the problem before it's huge, and listen. It may start with, let's say, chronic back issues or sacroiliac joint problems, and over the course of time, you end up with, let's say, incontinence, and you wonder, well, geez, why do I have incontinence? Oh, I must be getting old, or oh, I just gave birth, so that must be the reason. Not necessarily. We're seeing a lot more younger people with pelvic floor dysfunction, that they're here not because they want to prevent it, but because they actually have the symptoms and issues related to it. If you found this video helpful, please make sure you subscribe to the channel. We are on Instagram and Facebook. Follow us there. And if you have any questions, use one of the methods of contact in the description box to contact the office. Let's see you soon. Take care.